Hello, I'm Nancy Sutherland. Conversational ease should be an attribute of a salesperson that translates into one's selling value proposition. In fact, selling conversation becomes more conversational the more you know your product and the more you know your customer. Knowing your product is key when you are face-to-face selling a consumer a frothy, high-priced coffee. These consumers purchase products and services for use by themselves or by their families because of their perceived value. In contrast, other types of customers include institutions that are public and private, such as churches, hospitals, and colleges, where purchasing rules and procedures are as complex and rigid as those of government agencies. Institutional selling is our business content focus for this discussion. Selling to these types of customers means that your product knowledge must be dutifully and regularly studied and mastered. Yet as strong of the need for keen product knowledge, the supreme capability of relational engagement skills and trustful relationship even supersedes product knowledge. The time spent in selling relationally, professionally, with intense personal engagement will blossom over time to purchases and to increase in brand loyalty as the relationship becomes long-term. Conversation is a driver in communicating value and acts to solidify relational engagements that fuel business purchases. In institutional sales, you must be skilled with this measure and have your product feature benefit ready for communication seamlessly. Building trustful selling building partnerships is typically done through conversation and the perceived value communicated transfer into delivered value of the product purchase when used. Be mindful that dollars moved to you via sales from these massive business customers are done through the communication of value over time. Selling to the institutional customer is more complex and in need of greater understanding of the buying process and buying behavior, since the purchasing of your product will typically require the approval of a great number of individuals. You must do your due diligence to know your selling environment as well as the individuals who you will discuss your product. Given these statements, we will cover ethics again of the institutional selling relationship. You must behave ethically and comply to legal issues so that you develop long-term partnering relationships with institutional customers, again recognizing that selling in the institutional environment is more daunting than selling the consumer face-to-face, the frothy coffee discussed due to the massive size of the institution in the physical sense and due to the numbers of individuals needed to approve product adoption. For centuries, the guideline for business transactions was the Latin term caveat emptor, let the buyer beware. This principle suggests that the seller is not responsible for the buyer's welfare, meaning that you are not responsible for yourself or your product inside the institution. Is this principle still appropriate in modern business transactions? No, of course not. This is not ethical. For instance, if you operate in this fashion in the hospital selling environment, you will be crucified. Several factors have changed the nature of interactions between buyers and sellers. First, sellers are now large firms in fixed locations interacting with the same buyers over and over. This is the ethical selling business partnership that we are emphasizing. Second, modern communications facilitate the flow of information between buyers. Third, the level of competition has increased, and thus there is more emphasis on achieving long-term competitive advantages. Note that the selling relationship can and does result into the business transaction. If you are not presenting your product ethically, as the old saying goes, your sins will find you out. Thus, caveat emptor is no longer an appropriate method for conducting business transactions, primarily because it is not mindful of ethical and legal issues. The changing conditions mentioned here above mean that it is in the best interest of sellers to be concerned about buyer satisfaction. This is communicating value. Know that you must deliver value. Your product must perform as you say. If buyers are not satisfied, they will not make purchases from you in the future, and they will communicate their dissatisfaction to other buyers. Developing customer loyalty by maintaining high levels of customer satisfaction is a method of gaining long-term competitive advantage and selling leverage. In the hospital institutional environment, you will have to overcome barriers to your entry from the get-go. You cannot just walk in the door and freely access any physician, CEO, Chief Executive Officer, CNO, Chief Nursing Officer, CFO, Chief Financial Officer, PharmD, Purchasing Director, etc. at will. Typically, a hospital will require all sales representatives to sign in at purchasing or pharmacy. This is an issue of ethics again. What will you do? A salesperson must make the ethical choice when the situation arises. Many sales representatives will attempt, not comply. The consequence can mean being banned from the hospital. Yes, this can be enforced. You could lose your job for this infraction. If you have responsibility for sales inside the institution, sales will come from ethical behaviors, as non-compliance removes the privilege of access to the institution. Realize that the hospital will encompass all specialties, all physicians that deliver their medical product, all executive business levels, multitudes of nurses, including those that are clinical as well as educated business managers, a fiercely intense pharmacy with a fully utilized pharmacy and therapeutics committee stressing cost containment, infection control measures mandated with assessment and review teams, departments, and the cost affect and loss of performance outcome due to antibiotic resistance as their mission statement of communication to all inside the hospital, etc. Further, note that it's typical to have business-trained physicians and nurses. Many doctors and nurses have MBAs. You must know that these individuals will be the individuals that you will have trustful relationship-building conversations, as they are typically part of the buying process and decision-making process. Your selling conversations will encompass the true effect of marketing, selling a product, and having responsibility to educate the financial ramification of that decision to all key stakeholders of the institution. Succinctly, you must be able to show value clinically and financially. Institutional hospital sales are a daunting marketplace today. Institutional hospital sales are not for the weak, but for the overcomer. Research states that supply chain costs account for 20 to 30% of a hospital's budget, so aggressive expense reductions will prevail. Hospital salespersons should expect product standardization efforts to increase resulting into fewer approved suppliers with continued focus on proper product utilization to eliminate unnecessary waste and usage. The hospital salesperson will have increasing difficulty getting new products into the system, meaning committees, and will have continued pressure to reduce the prices paid for all items. This is a daunting selling barrier. You will have to understand your pricing structure and utilize negotiating skills impeccably. As the current hospital marketplace has resulted into product standardization that not only reduces the number of suppliers, but it also allows physicians to compare data and control the quality of care. This is a selling barrier. You must expect your product discussed among physicians, realizing that the physician must provide support usage of the product both clinically and financially. The physicians are subject to great peer pressure as well. Your game plan should be getting as many individuals in your camp as possible. Further, 77.5% of C-suite executives have resource utilization programs in place to control the use of extensive supplies and purchase services. This is a selling barrier. How will you overcome this selling obstacle? Additional targets are the areas of largest expenditures, such as physician preference items, PPIs. This must be overcome. Physicians were used to being king in the hospital, but due to the crisis in healthcare, they can no longer be. They cannot just use a product because they are the boss, so to speak, anymore. Please know that the number one selling pharmaceutical, for instance, will be the target to restrict or even displace if another clinically therapeutic alternative exists. What will you do? You must employ and sell yourself through all selling barriers, as the relationship can win the battle at times. Value analysis committees, VACs, will also continue to delay the introduction of new products, because each new potential entrant will need to be vetted. This is a selling barrier. What will you do? This is where a clinical experience program funded by your company can entrench your product and result in a goldmine of after-launch community use patient experience. This further results in the development of key users with sufficient clinical experience to become continual product proponents that can also be product lecturers for future sponsored educational events for other physicians. Delayed introduction of a new product is also a patient barrier and must be overcome, as patient outcome for healing is thwarted and delayed due to cost containment issues. What will you do? We cannot forget that patient centricity must prevail. To displace an existing product or be added to the approved list will require evidence. This is a selling barrier as well and must be overcome. What will you do? Be prepared with clinical evidence that demonstratively proves excellent clinical patient outcome, meaning the delivering of both hospital and patient value packaged in a less dollar expenditure. These committees have been in existence for years now, and they are growing in their level of sophistication. Use of VACs, value analysis committees, and other committees add a level of complexity to the sales process and delays the introduction of new products. This is truly a selling barrier. More and more people are involved in the buying process, exacerbating the complexity, yet you will still have the selling responsibility. Failure to adopt new innovative pharmaceuticals or devices does increase patient care costs, as healing is delayed, meaning more patient morbidity with potential increases of patient mortality. This translates to less patient and family satisfaction, i.e. less customer perceived value, thereby resulting in further not choosing the hospital when another service time is required. This is a selling leverage for the salesperson. Be skillful and educated in discussing value. You must have a depth understanding of customer perceived value, both as the product end user, i.e. the patient, and as the hospital, as the buyer, i.e. the institutional customer. You will have to be adept with business acumen, able to fully discuss the value added to the patient and to the institution with your product. Institutional selling is all about overcoming these barriers to selling. These barriers to selling are overcome with fierce intentionality, with relational engagement that is done ethically and in compliance with the law. I cannot overemphasize the value of you enough, and your ability to relationally engage others with excellence. Personal selling makes all the difference. You can overcome a daunting marketplace as an institutional sales with your personal value proposition. Further, I have served the pharmaceutical healthcare industry, the physician, and the hospital, and earned the President's Circle of Excellence for achieving the highest sales nationally. As I reflect upon this service, I accomplished this honor with fierce relational intentionality, coupled with impeccable ethical behaviors and in compliance with all laws. I continue to bring research excellence and thought leadership to the industry while regularly participating in international industry webinars with key stakeholders. I am Nancy Sutherland. I am honored to deliver you this business content.